All right.
Medicare is in trouble. That means the millions of seniors, military families, and people with disabilities whose care is insured by Medicare, like Ms. Leona Postoke, might be in trouble too. Without congressional action, and soon, doctors' Medicare payments could be cut almost 30% on January 1st.
You and I have a problem. We don't want to scare our patients. We want to take care of them. But this is the harsh reality of this new cut that's coming up. It's going to jeopardize your ability to see your doctor, and it's going to jeopardize my ability to keep my office open.
A new TMA physician survey shows if Congress allows the Medicare cut to happen, doctors will be forced out. If their rates are cut the full 29.5%, 4 out of 5 physicians told TMA they would have to at least consider limiting the Medicare patients they see. 71% would at least consider taking no new Medicare patients. Half of Texas physicians are considering opting out of Medicare altogether. Where would that leave Medicare patients like Ms. Postoke?
I don't know what I would do. I try to get help somewhere, I guess.
Here's the problem. It's the Sustainable Growth Rate, or SGR, the formula the government uses to calculate doctors' payments for treating Medicare patients. But the SGR is flawed, as it ignores how much it actually costs doctors to provide that care.
Okay.
The SGR has scheduled cuts in physician fees almost every year for the past decade. Only emergency patches by Congress have stopped the cuts. In fact, Congress had to intervene 5 times last year to stop a 25% cut. The green lines in this graph show what the government pays hospitals, nursing homes, and others to care for Medicare patients. Those payments increase every year, keeping up with the cost of providing care. The black line shows how much it costs doctors to run a medical practice. But the red line shows what Medicare pays physicians. You can see the payments don't keep up with their costs to run an office. And if the cut goes through, the gap grows even wider. It's off the cliff. Doctors are singled out because they're the only Medicare group paid based on the flawed SGR formula, so their payments don't keep up with their costs of providing care.
We just need this formula thrown out and the system fixed so that we can continue to take care of our patients.
Congress clearly values the care that hospitals, skilled nursing homes, home health agencies, and inpatient rehabilitation facilities provide Medicare patients because the government updates their pay each year. But to a Medicare patient, isn't their doctor's care equally important? That's why TMA believes Congress should not update the other providers' pay until they fix the broken physician payment system. But here's why Congress is reluctant to do that. Replacing the SGR will be very expensive. Look at 2012, when a temporary patch in green would cost $22 billion. Add to that the cost for a permanent fix in red, and it totals $342 billion. Every time Congress has patched the SGR problem, they added more cost to the long-term solution, kicking the can down the road. It's as if Congress has paid for the patches with a credit card, but it's only paying the minimum balance and building more debt. So at this rate, by 2016, creating a permanent fix would cost Americans $592 billion. When Congress passed the Affordable Care Act, the new health system reform law ignored the Medicare problem. But imagine health care is like a house. The physicians are the foundation of health care, while other Medicare providers, like hospitals, skilled nursing facilities, and home health care, are the walls. But because of these cuts, the network of physicians, the foundation, is crumbling. And without a strong foundation, the entire house will fall. You cannot have a strong healthcare system without a strong physician foundation.
My patients are worried every day when they say to me, what am I going to do? Should I do this operation now rather than wait because I may not have access? I don't want to tell them that they're not going to have access, but I also can't ignore the fact that we're both in trouble.
So once again, like for the past several years, physicians are forced to warn their patients that finding a doctor to care for them might be more difficult. Doctors say they will be forced to cut back on the number of new Medicaid patients they see, retire early, cut investments in their practices that could improve care, and yes, maybe even cut back on taking care of Medicare patients like Ms. Postoke. Please call or write your congressman now. Tell them not to update any of the other Medicare providers' pay until they fix the flawed doctor payment formula. Preserve the ability to see your doctor when you need to.